Today, we're going to talk about a subject that is often avoided in everyday conversation. Not because it's unimportant, but precisely because it's sensitive and rarely addressed properly. The potential dangers associated with anal sex. Whether practiced within heterosexual or homosexual relationships, anal sex remains a personal choice. However, it's essential that we understand the medical and anatomical realities of this practice, not out of fear or judgment, but out of respect for your health and well-being. So, if you're open to learning and ready for a clear, respectful, and science-based discussion, stay with me until the end. What you learn today may help you make safer, more informed decisions for yourself or for someone you care about. Understanding the anatomy. First, let's begin by exploring what makes the anal region fundamentally different from the vaginal canal in terms of anatomy and function. The anus is the final part of the gastrointestinal tract, while the rectum is the concluding section of the large intestine. Together, they form the body's natural pathway for waste excretion, not for sexual penetration. Unlike the vagina, the anal canal does not contain glands that produce natural lubrication. The vaginal walls are biologically designed to stretch, adapt, and recover during activities like intercourse or childbirth. In contrast, the anal canal and rectal walls are lined with thin mucous membranes and are far more delicate. This means the tissue in the anal region is not naturally prepared for repeated friction or stretching, making it more vulnerable to damage. Why is this important? Due to these anatomical and physiological differences, anal sex, especially if not practiced carefully, can lead to tears, abrasions, lacerations, or micro-injuries in the rectal wall. These injuries may not always be visible or immediately painful, but they can open the door to more serious health risks, such as increased risk of infections, including HIV and other STIs, inflammation or irritation of the rectal tissue, bleeding, pain, or long-term sensitivity. In rare cases, loss of sphincter control or chronic trauma. It's also worth noting that the rectal tissue absorbs substances faster than the vaginal wall due to its thin lining and rich blood supply, which can increase the impact of any pathogens or contaminants introduced during unprotected sex. Due to this greater fragility, anal sexual intercourse presents a higher risk of transmission of sexually transmitted infections, for example, and some other complications when compared to vaginal sex. The vagina is anatomically favorable for receiving the penis during penetration and for guiding sperm to the woman's uterus for fertilization. For this purpose, it is rich in lubrication, and its wall is much more resistant and compliant. But let's identify the 5 main dangers related to these anal sexual practices. First, a higher risk of injuries. As I mentioned, there is an anatomical difference in the fragility of the rectal wall and the anus compared to the vagina. These facilitated abrasions, lacerations, or lesions can cause pain, bleeding, and local discomfort precisely due to the lack of lubrication and the greater difficulty in penetration. Consequently, we have the second increased risk, which is the transmission of sexually transmitted infections. Given the ease of local trauma and laceration of this highly vascularized mucous membrane of the rectum, which can be, facilitated by anal intercourse, sexually transmitted diseases such as HIV, syphilis, hepatitis B, hepatitis C, herpes, and HPV can be more easily transmitted through these practices. There is another video on this channel where I explain each of these diseases and the inherent risks of anal sex involving each of them. It is well established, for example, that the risk of HIV transmission in anal intercourse can be up to 18 times higher than in vaginal sex. This is because the rectal mucosa, in addition to being highly vascularized, is rich in lymphoid tissue. This lymphoid tissue is the defense tissue where the viral load HIV is located. Therefore, when there is a lesion and laceration, the patient is potentially more exposed to acquiring a new HIV infection and transmitting it. Third, the increased risk of bacterial infections. As the anus and rectum are organs of the digestive tract, the gastrointestinal tract in its final portion, They are naturally colonized by various species of bacteria that do not cause harm to the region. These are the bacteria that colonize the intestinal flora. However, these bacteria can cause damage when transferred to other parts of the body, such as the vagina, urethra, penis, or even the oral cavity. Thus, anal sexual practices can favor the development of conditions such as balanitis, balanopostitis, urethral discharge, urethritis, as well as pelvic inflammatory diseases, which are very common in women. These conditions require immediate medical attention because they can lead to complications, pain, and discomfort for the woman's body. The fourth danger inherent in this practice lies in the development of fecal incontinence. Although rarer, frequent anal sexual intercourse can cause damage to the muscles and nerves of the anal sphincter. The anal sphincter is a type of valve that aids and assists in fecal continence, the mechanism of retaining feces in the body of men and women. When damaged, the patient may develop involuntary loss of feces, leading to anal incontinence. And lastly, the fifth risk associated with this practice is the onset or worsening of hemorrhoidal disease. As we know, hemorrhoids are nothing more than dilated veins. Paranal, anal or rectal hemorrhoids can be worsened or developed with anal sexual practices due to increased pressure and greater damage to the local vascule. Thus, patients may experience complications, aggravation of a pre-existing hemorrhoidal disease, or the development of it causing pain, bleeding, and local discomfort. Now that you understand the real risks of this practice and how it can affect your sexual health, let me ask you a direct question. Do you feel that your performance is no longer the same, that your potency has decreased over time, or that you are not delivering everything you could during intimacy? Then do the following. Take a look at this video here. Point your cell phone camera at the QR code or click on the link in the description. There you will discover a 100% natural solution backed by science that has helped thousands of men regain potency, desire, and confidence all in just 7 seconds a day. It's something so simple it almost seems like a lie. Don't forget to subscribe to our channel, activate notifications to stay updated on our weekly content. A hug, and until next time.